Maybe first, we should distinguish between primary, secondary headaches, because a primary headache is...
To me, they're almost all secondary, but...
Yeah, but a primary one is one that, is one of those just general headaches that we... I mean, yes, technically some of these are due to other causes. That's what we mean by secondary headaches. It's secondary to something else going on. But some of these headaches, like tension headaches, the classic migraine, are not secondary to a dangerous thing going on that we need to investigate.
But I would call tension headache a secondary because it's secondary to the tension.
Yes, I technically, yeah.
Yeah.
But yeah, with the red flags are the things that would clue us in to look for, go searching further for something else causing that headache.
Absolutely. So headaches, just like any presenting chief complaint, doctors can divide it into, there's metabolic causes, there's infectious causes, there's vascular causes, there's neoplasm causes, there's trauma. So a number of categories, and you can do that with headache too.
Yeah, absolutely.
And you can come up with something in each of those
categories.
But you were kind of hitting some of the major headache syndromes that we think about and worry about. But most people who experience a headache, it's something they've had before. It goes away.
Yeah, you take some Tylenol or ibuprofen, or you take a nap. But typically, people who have migraines know that. They know what to look out for because it's a recurrent thing.
That's right. The first time it happens, you have to get the workup, though. So.
Yep. Yeah. Excuse me. So where to start? Should we do the SNOOP10? So SNOOP10 is a mnemonic to remember all of those different things to look out for. And the 10 actually is just, there's 10 P's. 10 things that start with P. So
here's the 10.
Hey, there you go.
So the SNOOP10 has 2 N's and 2 O's. A P and a 10. It's a mnemonic. So the first one is systemic symptoms.
Yeah.
Fever, weight loss. I don't know. Are there any more systemic symptoms we need to talk about besides fever?
Maybe night sweats.
If you're thinking malignancy, could be also, well, night sweats could also go with infectious if they have.
It could.
Abscess from TB.
Yeah.
But weight loss.
And weight loss, absolutely. Yeah. So systemic symptoms would point towards a more systemic process, and neoplasm is one of those, which is the N, which is the history of having a previous, malignancy or cancer.
You had cancer ever before. We always have to think,
did it go to the brain?
Could this be from the cancer that the person had in the past, and now it's showing up in the brain? That can happen decades later.
Yep.
And then the other...
And the other end is neurologic deficit. Now, a lot of these will lead us down a path to look into it further, which is usually imaging to make sure, if we're looking for metastases in the brain, we need to get a CT scan. If there's neurologic changes, or this says deficit, vision changes, garbled speech, weakness somewhere, numbness somewhere. Again, it's moving on to get an MRI typically to look at.
That's both of the ends, neoplasm history and neurologic deficit.
Yep.
And then next is...
Oh, we're moving on to the O's. Older... onset. Yeah, we haven't done older age yet.
Onset. Sudden abrupt.
A sudden or abrupt. And this is... the word thunderclap is what we learned. Yeah, it came on like that. It was so quick.
Instant onset.
And what we're looking for there is a subarachnoid hemorrhage or a bleed in the brain, often described as, quote, the worst headache of my life. That combined with a thunderclap will very quickly get you a CT scan in an ER.
Very quickly.
Yes.
All right. After that comes...
Older age. This one's great because it says 50.
Greater than 50.
50.
So if you're like me...
I'm not that far off.
We're
knocking on the door.
We're more worried about your headache than if you're not as old as me. Okay.
And part of this is you've lived your life 50 years without headaches, and now you've got headaches. Something's changed. Something's going on there. And this is, like not your normal headache. If you've had tension headaches your whole life and you're 50 and you have your tension headache, okay. Or your migraines that are continuing into your 50s, that's not what we're talking about. These are new headaches that just started in your 50s. Whoa. We don't.
Well, you're talking, so.
Oh, okay. All right. So yeah, if you're over 50, new headache, it should be evaluated.
All right. And then after older age, the next one is pattern change.
Pattern change. Yeah,
this was
kind of what I was just talking about, that if you have this migraine that's been going on your whole life, and you have another migraine, and it's the exact same, we're pretty confident that's your normal migraine, or you get tension headaches, or every time during tax season you get stressed out and you are getting those tension headaches because of all that stress, and this is the same, that's a consistent pattern. However, if this is a brand new thing that came on that you've never experienced before, that is part of that.
All right, you want another P?
We'll do P's for a while here.
Give me it. How many P's? There's 10.
10 of them.
That's why it's called SNOOP10.
Snoop P10. Yeah.
Okay, so
Snoop
the next
10.
P is positional features. Positional.
Why don't you
features.
talk about that one? Yeah.
So if you are lying down and it's there, and when you're up, it's not. That's different from one that is. They're the same when you're lying down or when you're sitting up.
Right.
And so then we're more concerned about
changes of pressure inside the brain, like a CSF leak or intracranial hypertension.
Now, CFS leak, now that's actually worse when you're up, right? That's why we have people lay down after we do a spinal tap. Mm-hmm. Okay, but positional features. Precipitated by Valsalva/exertion. So this P means it gets worse if you
bear down.
Hold your breath and bear down. So if that's making it worse, chances are there's increased intracranial pressure with that one also.
Same thing. It increases pressure in the...
and maybe bearing down is how you caused it in the first place.
For an aneurysm? Is that what you're talking about there? Yeah. Meaning that it is getting worse. Today is worse than yesterday, which was worse than the day before, and it is just building up the symptoms of the headache, or it's combined with symptoms that are building up too. I didn't have anything, now I have other symptoms. Now that does fit with the other neurologic changes.
A subacute building up, but it can also be acute.
It could.
Within an hour, it's...
Take off.
Yeah. Both of those are bad.
Right.
Now papilledema.
This is not something you're going to know on your own unless it's significant enough that you're getting blurry vision.
It's not something they're going to know even if they come to our office.
That's true.
Pregnancy or just had a baby.
Or postpartum, yeah. Preeclampsia is a big thing that comes to mind for that, which is a...
venous sinus thrombosis.
Yes. Yeah, that's a good one too. Yeah. But there are so many things in pregnancy that can give you a headache.
Yeah, really.
So it is something that is serious that should be evaluated. And typically, the other thing is deciding whether or not to get imaging. Now that is up to your OB-GYN, and they have a lot of experience with it to know when and when not to. But yeah, a headache during pregnancy can be worrisome.
The super chat worthy term I just used, venous sinus thrombosis.
Ooh, yeah.
There are these drainage areas after blood is done its thing in the brain, it's going back in the veins to go back to the heart. There's these cisterns inside of the skull that blood collects in, and if it gets clotted, bad things happen for brain circulation, and so that's what a venous sinus thrombosis is. Painful eye. Autonomic features. What are autonomic features? There's a reason that autonomic sounds a lot like and looks a lot like automatic.
I do both at the same time.
If you're having
rest and digest while I fight.
While you're fighting. Eating a sandwich. Wow. So if you have features like that with something going on with the eye.
Yeah, so
with a headache.
The big thing is reactivity. So when a light is shined into your eye, it should constrict because it is decreasing the amount of light into the eye. Now, that being said, the opposite eye should also constrict. So we're testing both afferent and efferent nerves for nerves that go back to the brain and from the brain back to the eye there. So we do that. We do that on both sides to make sure that you're getting nice normal constriction of the eye.
I do it with an otoscope.
I do too. I just shine a light. People got these cool pen lights. No, I abandoned that long ago. There's an otoscope right there. I'll shine that in your eye.
I use it for everything.
Yep.
I use it for looking at skin lesions. It's traumatic.
Oh yeah, if you're in a car accident and have a headache, you're getting a CT scan because you may be bleeding.
Another P is pathology of immune system. Okay.
HIV.
All right. I guess that would be that. And
the
autoimmune.
Yeah, and what they're looking for is opportunistic infections there, right? So
what about
skids?
arteritis?
Temporal arteritis?
Temporal arteritis. Would that also be considered pathology of immune system?
I mean, that's
inflammation of your artery. Yeah. If it's tender when we push right on your temporal artery, that's where it hurts. Okay, then we're going to start you on some prednisone.
Yeah.
And then ask questions.
Get a biopsy. Yeah. Prednisone first, questions later. Yeah, but I think the big thing you're looking for here is if you have a immune system problem, you're on chemotherapy, you've got HIV that's uncontrolled and moving into AIDS. You are
our friend TB again.
Yep. You have certain other medical conditions that deplete your immune system that can set you up for certain opportunistic infections, and some of those actually can infect the brain and give you meningitis.
Yeah, who had an abscess in his brain?
Brain abscess.
Worm.
Oh yeah, that's right.
Brain-eating amoebas from.
Yeah. Oh yeah, Naegleria fowleri.
Oh my goodness, he remembers the name.
Oh man,
wow.
You know why I know that name? Because
You-
my son got obsessed with that and just went out learning about Naegleria fowleri. I was like, yeah, you're right.
I've never seen a case.
Yeah, they're exceedingly rare. I think in maybe 60 over the past 50 years or something. It's like less than 10 a year or something.
And then the last one is painkiller overuse.
Oh,
Rose, we want to talk to you about this one.
Rose.
That's her name.
Oh, okay. Yeah, taking too much painkillers can unfortunately mask scary things, and also coming off of that can kind of make things as well.
Now, when it says painkillers, it doesn't mean just controlled substances or opiates. This can be acetaminophen, Tylenol,
coming off of those
over-the-counter pain relievers that we use also can do this. And so that's what you think of when somebody's having that. Oh yeah, I have a headache 15 days out of the month and been going on for a while. You got to check to see, could they be in a cycle of you take the medicine for your headache so often that when you don't take it,
you're getting a withdrawal
headache.
You
have a headache.
Yeah, and that's actually very common with migraine medications, the abortive migraine medications. If you take
anything we treat a headache with,
pretty much, yeah, you can get a withdrawal headache. Caffeine.
So the way to address it is to
drink coffee.
Try to take a break from one of the pain medicines and then instead of taking all of them every time,
which is the hard
rotate over time, not take any single one for any more than 3 to 5 days, and then we kind of went through the SNOOP10, which is features, not necessarily red flags. So we talked about if it's sudden in onset, if it's associated with fever. Also, we have a term called nuchal rigidity that is sometimes talked about with the term stiff neck. And everybody's had a stiff neck. Very few people have nuchal rigidity. So imagine a neck so rigid that, first of all, the patient's so out of it that you can do this and they don't resist you. You put your hand under their head. That
itself is concerning.
Yeah. Mental status changes. Under their head and lift. And instead of their neck flexing, the whole body's coming off the tip. That's nuchal rigidity. That's something different than a stiff neck. So if you have that, if it's associated with fever and sweats, we're thinking
you're getting an LP quick.
Meningitis. If it's associated with the thunderclap headache, we're thinking of bleed in the brain and irritation of the lining of the brain called the meninges. Which would be a non-infectious meningitis, I guess. An inflammation.
Yeah. The neurologic changes are a big one. Everyone comes in and says, well, not everyone, but the big concern is, do I have something going on with my brain?
Not a tumor.
Yeah. And if there is a lesion or growth in your brain that is large enough to cause pain, it is typically in a place where it's going to cause other symptoms as well. Now, if it's close to one of those tracks where the cerebral spinal fluid flows, then that can give you that, postural headache and changes. But if it's in another place, like in the brain, typically you're going to get other symptoms, neurologic changes.
They can grow really slowly though, so the brain
It can be very subtle, but once you develop pain, typically you're having other things with it as well.
Yeah. So if you're like waking up with a headache and as the day goes, it goes away.
Yeah. Any headache that you wake up with and
it's been going on for a while.
Should be evaluated further.
And chances are it's not going to be gone some days.
Yeah. Right.
Yeah, I don't want to worry everybody who woke up with a headache. You can wake up with a headache and it's not something bad too.
Right.
Which means we need to have some kind of a disclaimer that even though we have that marking on our YouTube channel that we are doctors,
yes,
medical professionals, we may not be yours. So,
yes, you should
check with your doctor.
Check with your doctor. Yeah. If you have a headache, get it evaluated.
Yeah.
Your doctor can let you know if
don't not get it evaluated because of something we said.
Right.